When it comes to falls and fall prevention, we see a lot of patients who are like status post CVA or stroke. And when someone has a stroke, a lot of times other parts of their body on the opposite side where the stroke occurs are affected. So this can be anywhere from vision to spasticity in the arms. You kind of come like this a little bit. To decrease functional mobility. And functional mobility is transfers from shower to wheelchair and things like that. So when it comes to fall prevention, for occupational therapists, we like to work on things like functional reach. So by extending the area that a patient is allowed to reach for things safely, it can prevent future falls. So if a patient is trying to reach for something like this, that's not necessarily safe. You would try and educate the patients on proper body mechanics, meaning don't compensate with your neck for your shoulder. A lot of people tend to do this movement where like instead of lifting their shoulder, they lift their neck. So you want to teach, so as occupational therapists, we will teach patients to try and depress that shoulder, don't compensate for the lack of movement with your neck, because that can lead to a dangerous situation. If you're leaning too much with your neck and you lose your balance, that can lead to falls. So for fall prevention, occupational therapists really try to focus on allowing the patient to function within their range, and a lot of education and increasing safety awareness. We also work on seating balance. So seating balance, dynamic seating balance, is basically what I'm doing right here. I'm sitting down, but I don't have a back support for me. I'm sitting on this bench, but I'm able to keep my balance while being unsupported. So as OTs, we would like to increase their ability to reach while maintaining balance, and that's to prevent falls. So reaching for common kitchen items, it happens a lot. Someone goes to open the fridge, they reach for something, all of a sudden they lose their balance, and oops, there's a fall. So we want to educate patients on proper ways to open the fridge and reach for items in the fridge with proper body mechanics and paying attention to your core strength and your dynamic balance to allow you to safely participate in these things. Because most people don't think about it. They just open a cabinet, they reach for something, and then that's when accidents happen. So it's really important as occupational therapists for us to teach our patients proper body mechanics and safety awareness, and to increase their dynamic standing and sitting balance for these reasons.